Hello, a very good afternoon, everyone. Thank you so much for joining us today. So this webinar is part of a Smart Nation Together channel, which is actually organized by the Smart Nation Digital Government Office. So to find out more about this kind of free webinars, you can actually head to the link in the chat box, go.gov.sg/SNT. So today we are very privileged to have with us an awesome team from IHiS, and our speaker is Jennifer, right, from the IHiS Talent Acquisition team. So feel free to send us your questions anytime, during the webinar in the Q&A box, and we will get to those questions at the end of the session. So now over to you, Jennifer.
Just a short intro of myself. I started my in-house IT talent acquisition career in Hewlett-Packard. Thereafter, I switched to fintech, and here I am right now in the health tech industry, pursuing tech talent like yourself, and those of you who are keen to be part of this robust sunrise industry. Now, before we get into the presentation proper, let's have a little fun. Okay, can all of you take up your phone? Okay, go to your QR code and scan this QR code in front of you. For those who don't have that access, can you go to www.menti.com and use the code 40506395. We're just gonna have one Q&A time, just one question. Can all of you do it? And if you all have done it, maybe give me a little heart shape so that I know that it has been done. I can see some heart shape over here right now. Okay, because we have about 100 participants, so I'm just going to wait till about 100 of you giving me the heart, and I will show you the question. Okay, because everyone has to answer this question. It's very simple. 42, 46, heart, 47 heart. Okay, we are halfway there. Awesome. Okay. And now we have more participants as well, 118 participants. Okay, one more time. For those who just came in, can you please pick up your phone, scan the QR code, and wait with me first. For the rest who can't able to scan the QR code, please go to www.menti.com and use the code 40506395. Okay. All right. I'm having 63 heart. Okay. More of it coming. So I'm gonna wait till about 100 and I go to my question. Okay. Four participants raise hand. Nice. Okay, 77. 77 heart. Can I have more, please? Can we reach like maybe 80 plus? And then I'll go to the next question. Okay, it's actually a very, very simple question. All right. Okay. Are you guys ready? All right, participants, what is your favorite app? You can give one, minimally you have to give one, or maximum two. Please type away. For example, yes, WhatsApp is one of my favorite apps. Okay, but don't copy me, okay? What else? Wow, we're seeing WhatsApp getting bigger and bigger. Awesome. Keep the answers coming. You can choose more than one, by the way. Okay. Wow, Instagram, WhatsApp, Telegram, YouTube is the one that you see with the very big font, right? Is a popular one. Okay. Can anyone come up with something different? I was hoping that Trace Together is the bigger font one. Okay. All right. Come, keep it going. I see Health Hub as well. Good job. Health Hub has to be in everyone's cell phone. You all know, right? TikTok, we see Health Hub, Facebook, Trace Together. Okay, nice. Awesome. Okay, as you can see from here, WhatsApp still remain the more popular one. Can I just hint to all of you that those who do not have Health Hub in your apps right now, you should actually download it, because Health Hub will give you a lot of access, like your appointments, as well as your COVID status and things like that. So do go and download our Health Hub app in the App Store near you. Okay. All right. So thank you so much. This has been fun. I hope you guys are a little bit warm up already. Okay. Now let's go to the next segment. All right. Without further ado, I'm going to delve with all of you on why you should explore your career in health tech. Health tech is a sunrise industry. That's because healthcare is actually one of the world's largest and fastest growing industry. This is of course due to the growing and aging population, which causes our healthcare to grow to meet the demand, as well as to stay ahead with advanced technology. Just in Singapore alone, we are currently serving more than 12 million hospital admission and outpatient attendances of our public health institution. As you already know, we have 3 public healthcare clusters. So what are they? As you can see from our Singapore map, we have National University Health System, which is known as NUHS. They serve the western region of Singapore. Then we have NHG, which is the National Healthcare Group, which serves the central part of Singapore. And we have SingHealth, that is in the east. As you can see from here, today we serve 16 hospitals and 20 polyclinics. By 2020, we will have 12 more polyclinics, and we will actually now en route to have 3 more hospitals coming our way. So as you can see that in Singapore alone, we are definitely expanding quite a fair bit. Okay. So IHiS. IHiS stands for Integrated Health Information Systems. It is a health tech agency of MOH that serves the 3 clusters which I mentioned earlier. What is our mission? Our mission is to digitize, connect, analyze Singapore health ecosystem to improve our nation's population health. And how do we do that? By integrating highly resilient, cost-effective, and intelligent technologies with process and with people. So there you go. It's meaningful. This will bring us to the next segment of our technology. As mentioned earlier, all the public health institution technology is powered by IHiS. We design, implement, and support over 700 IT systems, as well as technology projects that is worth over 850 million. I'm going to just pause here a bit. Just now when you're playing the game of what is your favorite apps, right? You probably will have like 100 apps or maybe less than that in your phone itself. You can just imagine that we are actually serving over 700 systems for our public health institution. Okay, and on top of that, at the same time, we serve over 73,000 healthcare professionals. As you can see, we have served doctors to acupuncturists, speech therapists, physiotherapists, dentists, and even opticians. And IHiS play a very critical role in our nation's fight against COVID-19. Our technology enabled the setup of community care facilities, which is known as CCF. If you read newspaper, you would know. Okay, we have the vaccination center where we go there to have our jabs. Okay, and we also serve the public health preparedness clinics. Those private clinics, they are enabled to conduct tests for COVID. We actually play a critical role in this aspect, just amongst others. Okay. And one of the systems that we built in relation to COVID-19 is actually called the CTR, which stands for COVID Test Repository. What does it do? It connects testing labs, hospitals, and ministries so that patients can be isolated within hours of testing positive. Another technology that I would like to call out is CAPE, C-A-P-E, which is the Community Acquired Pneumonia and COVID-19 Predictive Engine. This technology actually enabled Changi General Hospital to determine the severity of patients who contracted COVID-19. As a result, the hospital is able to determine ahead the numbers of hospital beds that can be available, as well as to create alert on the critical needs of ICU facilities. So I hope you have all been inspired thus far. We are going to take just a little pause again by having a little fun. Okay, so once again, could you please take out your phone and scan the QR code? To do the same thing, for the code is 40506395. This time round, we will have 2 questions, and it will be 2 very simple questions if you have pay a little attention to me during that 5 or 10 minutes, okay? Okay, now I'm going to show the question. Are you guys ready? Okay, participant, in 2020, how many attendances and outpatient did the public healthcare serve? Fire away. Wow. The numbers are climbing really fast. Very good. Keep it coming. Keep it coming. Okay. And for the second question, are you ready? In the slide which I've shown earlier, how many COVID test results has been stored in the COVID test repository? 9. It's good to know that no one put 100,000. Great. All right. Okay. All right. I just want to share with you. The answer actually is 7 million plus. We have 7 million test results stored in our CTR system. Okay. All right. So we are going to the next segment. Okay. For those who have said 7 million plus, you have done well. Okay. And in the next segment, I would like to talk more about the ongoing learning opportunities. At IHiS, you will get the opportunity to work on national projects alongside with smart techies and dedicated project managers. We are actually strong advocates for training and development. This year, we set up the IHiS Academy to collaborate with Institute of Higher Learning, just amongst others, okay, to support continuous learning through multiple modes beyond just attending training courses. Late last year, IHiS was conferred the Skill Future Employer Award for our efforts in 3 areas. Number 1, championing skills development. Number 2, supporting staff in their pursuit of lifelong learning and designing skill-based career pathway for employees. The next question I believe all of you want to ask is that, is it possible to have a career switch to health tech? The answer is a resounding yes. We actually partner with IMDA on this Tech Skill Accelerator initiative. It's called the TESA program. One of the part of this program is to have professional who does not have IT background, but is interested to make a mid-career switch. They will actually go through the comprehensive training that we partner with IMDA to make sure that they are prepared to take on this career switch. Okay. This is one of our staff who actually majored in the English literature from NUS faculty. He started his career actually as a copywriter, but he went on to become a coder when he joined IHiS. Of course, you can see from the challenges is that you definitely need to do some adjustment. There will be some steep learning curve that you have to go through. But if you actually make up your mind that this is going to be the career switch that you want to go for, nothing will be too hard, especially when we have very strong facilities here that we can actually get you up to speed to where you need to be for the role that you have applied for. Another colleague that I want to share is that she was actually a nurse at KK Women and Children Hospital. And in 2013, she too decided to make a career switch that combined her passion for healthcare and IT. And here she is right now. She is our assistant director in one of our group in clinical informatics group, where she worked with doctors, nurses, pharmacists, and health professionals to improve the quality of care that is provided to patients. And all these are only possible because we are passionate in molding tech talent for our nation's health tech. So, are you burning with passion yet? Okay, let's go. Now we want to talk about the career opportunity at IHiS. Currently, these are the health tech positions that we are hiring. Do you want to be a cyber defender? Then join our cyber defense group. How about wanting to be a data mountaineer? Then you'll be looking at data engineer, data analyst, or even a data scientist role. Or what about a business strategist? Then you might want to be assistant analyst or a project manager. Otherwise, a ninja coder, that would be your software engineers or even a software developer, or maybe even a system whiz. So these are the main roles that we have, and there are more as well. Okay. Now, these are actually for experienced hire. The next thing that I want to talk about is for folks who are in their early career. For those who are in their early career, we have what we call the Graduate Development Program. This is a 6-month program that incorporates online-based and on-the-job training, which are designed to help fresh graduates to establish a strong foundation for a rewarding career that would also make a difference in building a healthier nation. We also encompasses This program also encompasses an all-rounded experience from career guidance to technical and soft skill training. And for this fresh graduates, the benefits of it is that you actually have direct access to senior management, as well as to develop competency through soft skill, when I just mentioned earlier on, and technical training. And of course, you have the opportunity to upskill with your online-based and on-the-job training. Okay, on the right-hand side is the eligibility criteria, or you may wish to scan a QR code for more information. Okay, so what's in it for me when I joined IHiS? Let's talk about not only just your technical skill. In IHiS, we pay you competitively to have a purposeful career. Over in IHiS, we provide a competitive remuneration package, a generous annual leave on top of welfare leave, such as birthday leave, family care leave, as well as comprehensive medical benefits. Of course, not to mention competitive bonuses as well. We even have a gym and cafeteria solely for IHiS staff only. On top of good perks and benefits, one plus point about working in IHiS is actually work-life harmony. During interview, candidates always ask me about the culture of IHiS, and I always tell them that over here, we work hard, we play hard. Prior COVID, we have annual events such as family days. In fact, in 2019, IHiS booked the entire Universal Studio for the staff and family. And every year, we have a different theme for our D&D, as you can see from the pictures over here, what the theme that we have for our D&D. Okay, but of course, now with COVID, we may not be able to do all these activities, but we still have our work from home fun challenges, such as the egg challenge. Also, we are also given a pot of fun for virtual team bonding activities as well. And for those, if you come and join us, you will know that we actually do have interest group for different kind of employee. For those who love sports, we actually have interest group for soccer, badminton, or even running. Okay, for those who are not so keen about sports, we have other interest group as well, such as photography, recreation, and we even have makan places in Singapore. So there you go, the kind of work-life harmony over in IHiS. So start to update your CV and apply to one of our current or more 800 roles in IHiS. With that, I would like to leave you with this short, inspiring video.
There is a force within us. A steadfast pump with a steady rhythm. A pulse so strong, igniting the life within us, enabling us to live day after day. But are we truly alive? We search for deeper meaning in our lives, a purpose that compels us to make a difference. We have been pumping our hearts into delivering a life force, one that enables our healthcare system, a network of technologies that helps our healthcare professionals to excel in their jobs. At IHiS, we build health tech for a healthier nation. and we strive to make it better every day. To empower our healthcare workers so that they can help their patients thrive. Our purpose to solve healthcare's biggest challenges through technology sparks a fire in us. IHiS is where we truly come alive. Are you a game changer?
Okay, all right. I hope all of you are inspired by this video. Now, before I go into the Q&A, I'm pleased to inform that we actually have an upcoming event. It is called the HealthTech X, which actually will be held virtually for 2 days from 12 to 13 of October. In this event, you will learn how technology is a key enabler in transforming healthcare. This year's theme is Tech for Population Health. It means your health, my health, health of your loved ones as well. So this is a free program for the public, so go register now. Once again, you can scan the QR code for more information and do register.